Kasi simula pa lamang ng taong 2020, subalit tayo ay nabulaganan ng maraming mga challenges sa ating kapaligiran. Nariyan ng pagputok ng Bulkang Taal noong Enero at ngayon naman ay ang worldwide health crisis dahil sa tinawag na 2019 novel coronavirus na ang opisyal na pangalan ngayon ay COVID-19.
At nagulat nga po ang buong mundo sa bilis ng pagkalat ng virus na ito. And based on the latest data from the World Health Organization, this new virus has infected tens of thousands of people from 28 different countries and killed more than 1,000 people na po. At actually, Bishop, malaki rin po ang epekto nito sa ekonomiya ng mga bansa dahil nga sa mga travel bans na ipinatupad para maiwasan ang lalo pang pagkalat ng coronavirus.
Hindi lang yan, pati yung export galing China. Kaya naman sa ating episode ngayon ay pag-uusapan natin ang mga hakbang na ginagawa ng ating healthcare system sa Pilipinas upang maiwasan ang pagkalat nito sa ating bansa. When we have interviewed no less than the President of the Philippine Medical Association, si Dr. Joselito Santiago, in our What's Brewing.
At sa Espresso Self naman ay pag-uusapan ng kahalagahan ng public awareness and health education, lalo na sa mga urban poor areas, para din maiwasan ng mga infectious diseases. At sa Health Talks din ay pag-uusapan ang pagtalakay ng mga common viral disease symptoms at kung paano ito maiwasan, kasama ang isa nating eksperto. So very informative po ang ating hinandang show para sa inyo ngayon, kaya wag po kayo maglilipat ng channel. Ako po si Reza Abante Yebra.
At ako naman po si Bishop Ruben Abante. Join us and let's have good talk over good coffee. Welcome to the Lighthouse Cafe. Mainit ang usapin ng COVID-19 o mas kilala sa tawag na coronavirus. Ang sakit na napakabilis na kumalat mula sa China hanggang sa 28 or even more than 28 countries sa iba't ibang bahagi ng mundo. At kasalukuyan ay mayroon ng mahigit na 2,000 ang naitalang biktima at namatay sa sakit na ito, with over 75,000 din na nagkaroon ng sakit. Ano po? At bagaman confirmed cases pa lang ang naitala sa loob ng ating bansa, mayroon namang mga naitalang bagong kumpirmado mga kaso ng mga Pilipino, lalo na ang mga nakasakay sa isang Japanese cruise ship. At kamakailan lamang ay may isang kumpirmadong kaso rin na isang Pilipino OFW sa Hong Kong. Talaga nga bang handa ang ating bansa sa epidemic na ito? Ito nga, kung epidemic o pandemic, pag-uusapan din po natin yan, ano? At ano-ano ang mga hakbang na ginagawa ng DOH at mga attached agencies upang maiwasan ang higit na pagkalat ng sakit na ito. And we have with us no less than the President of the Philippine Medical Association, at napaka-pribilehiyo po para sa atin na naririto ang Presidente ng PMA, walang iba kundi si Dr. Jose Santiago Jr. Magandang araw sa iyo, Dr. Santiago.
Magandang araw at magandang buhay, Bishop.
Oo, at maraming salamat at napaunlakan mo kami sa iyong presensya.
Well, anytime po, Bishop.
Anytime.
Basta kayo po ang
sabihin
mag-imbita.
na natin, palagi na to para ano.
Well, we should do this more often, Bishop.
Well, in fact, nais ko pong sabihin na ang PMA po, ang Philippine Medical Association, na pinangungunahan ni Dr. Santiago, ay ito nga, bagong-bago, partner po namin sila sa ating tinatawag na The Great Lighthouse Foundation sa mga engagement po natin para bigyan ng wellness ang mga iba't ibang community. At kung yun nga, we are so blessed and we are so privileged to have him with us today. Okay, now, Doc Santiago, ang una-una po, itong COVID-19 na ito ay nanggaling doon sa pangalan na nCoV, no? Or nCoV.
nCoV.
Ibig sabihin, novel coronavirus. At ngayon, tinawag na COVID-19. Why the change?
Well, it started as a nCoV because it's a novel. It's new.
It was new.
I mean, it's not really in the... they have not really discovered yet the name of the virus. That was its novel coronavirus.
Okay.
Because only lately that they isolated the virus.
And then inattach na lang yung taon, ano? 2019.
Yes, 2019. It was discovered nCoV 2019 or 19.
Yes. Oo. So ginawa na lang COVID na coronavirus disease.
No, it was later on from nCoV to COVID 19 because
Ano ba
number
ang-
19.
Ano ang nagdedesisyon sa mga pagbabagong pangalan na yan? O
Well,
pagbibigyan ng pangalan?
Well, I think the WHO and other the World Medical Association are really trying to name it after they discovered the virus. So the disease itself is the COVID-19
Yes.
because they already discovered the coronavirus.
Alam nyo, kapag tinitingnan pa ito sa maraming mga television, mga pictures, pinapakita pa yung mayroong mga kuro-kuro ng bilog na gano'n, ano, na yun ang itsura ng virus itself. Pero ito ay kategorya ay coronavirus.
Exactly.
Ibig sabihin, maraming uri ng coronavirus.
Well, if you see the coronavirus under the electron microscope, it's like a crown
Yes.
around
Yun.
on the genome of the virus. You can see the crown like
So,
a crown.
porque ito'y novel coronavirus, ito'y bagong uri ng coronavirus.
Yes, but it came from the family of coronavirus.
Ayun.
Also.
Merong pamilya ng coronavirus. So, ito'y bagong silang.
Yes, kumbaga to, it's a new family.
Ano ba ang yung mga dating alam na coronavirus? Anong klaseng kakaibang sakit ang dinadala?
Well, katulad na naranasan natin dati, meron po tayong SARS, no?
Okay.
Yun po yun.
So SARS is another kind of within the family ng coronavirus.
Then MERS-CoV,
Okay.
it's another coronavirus
Pero
family.
sa mga datos parang mas deadly yung SARS.
Well, because of the high fatality rate, no?
Yes.
But I think this one is really transmission is really very fast. That's why you have a increased number of infected patients, but the fatality is still low, no, compared to
SARS.
SARS, and I think more of Ebola. Ebola has more deaths.
Ang Ebola ba coronavirus?
Hindi.
Iba.
Iba yan.
Ano naman ang uri ng coronavirus?
Well, it came
ang Ebola?
from a monkey, no? From Africa.
Oh.
Nag-origin sa Africa. Ang MERS-CoV for Middle East.
Ang Middle East ang Okay. Alam mo, sa kapakanan ng ating mga nanonood, kinakailangan ma-distinguish natin yan, no? Kasi syempre, akala nila yung Nobel coronavirus ang tawag, para bang marami nakasulat na parang Nobel, no? So, bago.
It's a new one.
Okay. Alam mo, isa pa, gusto natin na i-correct yung maraming mga, kung sabi-sabi ba, lalo yung kumakalat sa social media.
Yes.
Ang daming mga fake news, yung mga hindi naman validated na mga kung ano-ano ipinapasa, na pinapaniwalaan ng mga tao.
That's true.
Kaya napakaganda na mayroong Philippine Medical Association. Now, ang Philippine Medical Association po, you always work alongside DOH for any policy.
Yes, actually we are collaborating with the Department of Health now, DOH and PMA.
Yes.
Since under PMA we have several specialty divisions and specialty societies, under which is the Infectious Society, Adult and Pedia.
Oh.
So we have this infectious consultant or specialist that we really have this kind of
And talking about
information.
PMA, kayo ang pinakamalaking asosasyon ng mga medical practitioners
Yes,
sa bansa.
that's true. We are the largest medical
Ilan po ang
organization.
members ng Philippine Medical Association?
Right now we have 85,000 members
all over the country.
all over the
At
country.
iba-ibang fields yan, iba-ibang mga...
Well, it could be specialists and specialists or generalists. So it ranges from generalist to specialist.
So tumutulong kayo, halimbawa mayroong ganitong bagong klaseng sakit,
Yeah.
ay katulong kayo sa pagbaba ng mga information tungkol dito.
Yes. Actually, since we're flooded with so many information like from social media, napakadami po information. So sometimes the public, because of the access to technology, the public are not confused where to
Totoo.
get the right information. That's why I think in the Senate, no, lately, Drilon filed a resolution that only the DOH will give the advisory.
Para minsanan lang.
Yes. And I think DOH doing a great job also. They have been daily advisory every day, so that to keep you updated on what's going on in the world. Of course, especially in the Philippines, no.
At hindi naman magbibigay ng advisory ang DOH na hindi kayo sinasangguni, of course.
Well, of course, we share our data also. and then we share information with the Department of Health, especially during the time that really there's really a fake the news or wrong information that we so we can the communication is very important. It's a key because you may create an unnecessary fear or unnecessary panic to our countrymen, no, ating mga kababayan, no, especially probably in in the use of in the purchase of masks, no, sometimes they do not need it. So there are a lot of our patients and of course our health workers who need more on these masks, no, especially our hospital personnel.
Well, siguro kayo ang talaga makakatugon sa tanong na ito dahil siyempre ang ating mga kababayan siyempre porque mataas ang kanilang parang sense ngayon na siyempre nagkakaubusan ng mask, nagkakaubusan ng alcohol, nagkakaubusan ng mga disinfectant. Kumusta naman ang ating mga medical practitioners? Sila ba are they pressured? Meron ba silang tensionado ba sila? Like ini-imagine ko doon sa China, Doc Santiago, mismo mga doktor ang nabiktima ng COVID. Kumusta naman ang ng mga doktor natin dito?
Well, for me, I mean generally they're very comfortable. I think they're confident.
Yes.
That we're still in control of the coronavirus here in the Philippines, no? In fact, there's no local transmission as of this date.
Yun ang gusto na. There is no local transmission.
That's correct.
Ibig sabihin, na-contain natin na kung meron mang positibo, yung mga nanggaling lang sa labas at na-contain.
Yes, that's true.
At kapag halimbawa, ikaw ay anong tinawag doon? Ikin-quarantine.
Yes.
Okay? Ikaw ay hindi pa sinasabing meron kang COVID.
Yes.
Ikaw ay person under investigation.
That's correct. Or PUM, under monitoring.
So hindi POI, POM.
The
PUM.
PUI and PUM, or PUM.
Mas maganda siguro yung PUM, ano?
PUI, okay lang. Parang halos pares lang din.
Oo. Para kasi pag investigation, parang criminal.
Yes, parang
may kasalanan
suspect ka na agad, no?
Suspected
Parang
na, no?
you already tested positive.
So, monitoring. So, ang PUM o POI ay hindi kumpirmadong may COVID, no?
Yes.
Siguro, siyempre, kinwarantin sila porque may sipon, may ubo siguro, at may lagnat.
Basically, galing pong China.
Basically, galing China.
They traveled to China, Hong Kong, Macau, and yeah.
So, kahit walang manifestation ng ikaw quarantine.
Yes.
Okay. So, yun po ang maliwanag. Medyo talagang inaayos ko po yung tanong para maliwanag ang dating sa ating mga Kung ikay nanggaling sa China, porque dito talaga ang concentration ng COVID, no? Lahat ng infection, ay talagang kina-quarantine. But it does not necessarily mean may sakit ka na.
Yes, that's true.
Imo-monitor ka. Okay. And that would last 14 days.
Well, that's the incubation period that they recommended by WHO. But I think you have already allowance of 14 days. Maybe 10 days would be...
Pwede na yung 10 days.
But I think just to make sure. That's
So why
to 14
should there
days.
be such an incubation period?
Because that's the incubation period of the virus.
Ibig sabihin, may virus ka na kahit hindi nagmamanifest.
Yeah.
Kahit wala kang simptoma, no, meron ka ng virus.
Yes.
Ang tawag doon ay asymptomatic ka
Symptomatic.
at nakakahawa ka na.
It could be infectious already.
Okay. So, ibig sabihin, doon pa lang sa level ng natin, pagka-quarantine natin, pag-isolate, epektibo tayo.
Well, yes, in a sense that we are so far effective in our management of our coronavirus.
Kasi halimbawa,
In containing coronavirus.
ako nagpunta ako doon sa sa Athletes Village sa Kapa, sa Tarlac. And we were trying to look into some facilities. We were not allowed to go inside. Yung pala, talagang hinahanda nila
Yes.
para doon sa And nung dumating yung ating mga kababayan, no, at doon sila dinala,
Yeah.
no? Yung mga barangays around, nag-alala sila na baka umabot sa kanila yung infection na hindi naman pala dapat.
Hindi yun dapat.
Kasi this is not airborne.
Yes.
Okay. Anong limitasyon?
Well, you could be, contagious just in case when a person infected with virus, when you cough or sneeze, coughing or sneezing,
Yung, oo.
coughing
Pag-ubo,
with
pagbahing.
pagbahing.
Oo.
Kasi that's a forceful eh.
Oo.
So it can reach to up to 3 meters.
O, mga 9 feet, 10 feet, ganyan.
Tayo po, I could reach that pagka nagkaroon ako ng
Ito,
bahing.
nag-uusap tayo. Oo.
Aha, yan po, pwede yun.
So, sinasabi yung mga droplets ng
Of
mga
secretions.
laway and everything.
Secretions po.
Secretions.
Coming from the respiratory tract.
Okay. So, imposible na umabot sa kabilang barangay yun, sa kapitbahay.
Hindi
rin.
naman ho.
Oh,
Definitely. It's just probably an information that we should coordinate with the barangay and the local government unit that assuring the public of safety and of course
Yes.
the safety of the
At syempre, yung halimbawa, kahit hindi ka inabot ng droplets,
Yeah.
no? Pero umubo ka sa kamay mo, yeah, 'di ba, no? Bumahing ka, nagbara ka ganyan ka, so naririto.
well, it could stay there for 2 or 3 or 4 hours. But
Tapos
of course,
hahawa ka sa mga kung saan-saan.
yes. But of course, you have to, unless you rub your hand, your fingers with, to your eyes or to you make some.
Pag nasa kamay mo, okay pala, wala pang ano yun.
Wala pa yun.
Wala, kung may sugat ka siguro, no?
Hindi naman basta entry sa fluid.
May entry yung fluid.
Um,
I see.
secretions.
So, kaya
Respiratory secretions.
kaya pinagmamas natin.
Yes.
Ang merong nagbabahing, tsaka merong lagnat.
Yeah.
So, ang dapat na mag-mask yung may virus.
Yung may sipon,
May sipon, oo.
may ubo.
May ubo. Sila
Yan
ang
po.
dapat mag-mask.
That must.
Kasi
And then for those who traveled from
Oo, iniisip
from-
na iba ang
from
default
China.
natin, nakamask na tayo lahat. Kaya lahat nakamask.
yun nga po, that's why we're trying to correct that information or misconception against this virus, no?
Oo.
Well, we probably went beyond or probably went beyond our expectations, no? Masyado namang naging over
Oo.
in our
Can we therefore say categorically na ang mga persons under monitoring o investigation
Yeah.
ay naka-isolate sila?
Yes.
So, ibig sabihin, secure tayo na hindi kumakalat ang COVID sa ating mga lipunan. Okay? Kung meron man tayong pag-iingatan, yun ding dapat na pag-ingatan natin.
Yes.
Ng mga ordinaryong mga sakit, ordinaryong mga virus natin, di ba?
Well, that's true.
Yun. So, ibig sabihin, sinasanay na rin tayo sa pag-iingat, paglalagay ng mask, kung meron kang nararamdaman, paghuhugas ng kamay, hygiene.
That's true.
Oo.
Well, I use your comfort room.
Yes.
I saw the proper hand washing.
Yes.
That's very correct. That's the right way to do.
Salamat. Punta po kayo sa Lighthouse dahil correct na po yung aming
Yeah,
ginagawa.
that's right. That's right. That's really the proper. And we had that in the hand washing day, the word hand washing day.
Yes.
And we had this campaign on the proper hand washing.
Alam mo, isa sa mga services namin dito, nagturo pa yung isang namin on how to properly wash your hands.
That's correct.
Oo. Talagang dinemonstrate sa harap. In a church setting. Tinuturo yun. Pagkatapos, nagbigay pa ako ng guideline. Like, ang unang guideline natin, you be knowledgeable. Kasi it's actually the lack of knowledge that destroys people.
Well, that's true. I mean,
Pagkatapos, be clean. Observe hygiene. Tapos, be well. Oo.
well, that's really should be the right approach, no? I mean, not only with coronavirus or COVID-19, no? I mean, any viral infection could be you could really transmit, no, through.
So ang ibig sabihin, itong sinasabi natin ito at yung sinasabi ng DOH at sinasabi ninyo ay more of prevention.
Yes, no.
O, tama nga naman yun.
That's a very good preparation against not only virus but also all kinds of diseases also, whether
Okay.
airborne or droplets of infection, even tuberculosis.
Yes.
Yeah, I mean, I'll be more scared about tuberculosis rather than coronavirus
Oo.
because it's really infectious.
Now, Dr. Santiago, ang isang tanong ay ito, no? Bali, kung halimbawa na meron na namatay sa mga nandito, meron na tayong fatality, no?
No, yeah.
Sa atin, isa, di ba?
At hindi po Pinoy.
O hindi Pinoy.
Ano,
Ito
check po.
galing doon sa Wuhan din.
Yes.
So even for that matter, pinag-usapan din kung nireject pa nga yung halimbawa, i-cremate, parang nireject ng mga dahil, ewan ko, natatakot yata sila. Pero, you know, we can therefore say that our communities are safe.
Well, yes, that's where we can say
As
that
it stands now.
Yeah.
Oo. And kung ano yung ginagawa natin, hindi para mag-threat sa tao. Kaya hindi dapat matakot ang ating mga tao.
Well,
Tinuturuan natin sila rather to be proactive sa bagay ng prevention.
Yeah. Well, I think that's really probably a gentle reminder to all Filipinos to really concentrate or really focus on the prevention rather than on the treatment.
Tayo pa naman, ang ugali natin hanggat walang sakit,
Oh, yeah.
hindi magpapatingin, hindi
Well, that's very
nag-aantay tayo
very
ng
typical.
last minute. Di ba?
Well, teka lang muna.
Wala pa naman, pwede pa siguro.
Yeah.
No? Pwede na yan, okay na yan.
Because I think that's really the problem now in China because because of they contain already the people in Wuhan, China, and then they're asymptomatic, so they don't really care about, sometimes they don't feel anything.
Mm.
And for all you know, they're really infectious already, even in the first few days of their incubation period.
Oo.
So kaya they got this high number of infected cases.
Okay.
So yun ang isang And dito, I mean, it's good that we're a tropical country. I mean, it does not really thrive much on the hot tropical country.
Please explain more. Nabanggit mo na rin lang yan, ano? Being a tropical country, ano ang buhay, anong survival dito ng virus na ganyan?
Well, I think since it's Wuhan, China, I think this really the environment is more of the cold climate.
Maganda para talaga.
Malamig po eh.
Oo.
So tayo medyo warm dito. Of course, because of the sun.
Oo.
I think yung viruses are really contained, no? Or that's a thrive much on the tropical countries.
Okay tayo. Mas blessed pala tayo.
Well, that's true. We are blessed with the
Yeah.
sun.
Okay. Now, yung mga ospital naman natin, are they really equipped for such a COVID like na ito?
Well, very one or two or few hospitals are really equipped with this kind of.
Kaya talagang pag-iingat lang talaga.
All I can say is they're just doing the prevention thing. But
Ang nakakamatay yata yung panic, yung takot eh.
yes,
No? So, itong bagay na ginagawa natin ay naa-arrest natin ang takot ng mga tao.
well, you create panic or you experience panic if you're not prepared.
Yes.
If the country is not prepared with this kind of virus infection, I think we'll really go into panic. That's why any infection or any disaster, preparedness really the very essence of our
Naalala ko tuloy
months,
ng
man.
mga Boy Scout pa tayo. Laging handa.
That's correct. That's basically true.
Oo.
You have to be prepared. No? Not only in times of this, epidemic or in times of disaster also.
Kung tatanungin kita, Dr. Santiago, ang sasabihin natin, keep yourselves healthy.
Yeah.
Ano ang unang 3 bagay na dapat tandaan ng mga tao, how to keep themselves healthy in the face of this threat?
Well, I think you have to discipline ourselves.
Okay?
You have to really make sure that you don't abuse your yourself. I mean, working too much.
Oo.
Like you have to really maintain your body also. Your like your sleep number of sleep should be
Oo.
at least 8 hours.
Okay.
And the food that you are eating, should be
Tapos
more or less,
liquid.
and then of course fluids, and
Oo.
of course the proper cup etiquette, no?
Oo.
So and
Pwede
like
pala
in
tawagin etiquette na rin yun.
bed etiquette, no?
Oo.
Because you have to use the
It's
handkerchief.
not just hygiene, but etiquette.
Yeah. Because you have to respect also not only coronavirus but other infections also, like tuberculosis or other infectious diseases that you may
Para kasi
get in
minsan, parang
contact.
naninigarilyo eh. Kung bubuga ka pa sa mukha eh. Parang gano'n,
That's true. Well, it's really yeah. Of course, basically you have to cup etiquette, discipline, and of course the lifestyle, no? As I said,
Lifestyle.
of
Okay.
course,
Wag-
smoking will be
Moderate yung
stop.
ano mo.
Stop smoking, no?
Oo.
And of course, moderate in everything,
Yes.
or in terms of alcohol and other.
Sa mga vitamins or supplements, what can be recommended for our people?
Well, I think you can take vitamin C, no? You can take any multivitamins as a food supplement, no?
Okay.
There's no, I think that's really because by taking vitamins, it makes you aware of, you have to protect yourself against viral or viral infection, especially.
Oo. Okay. Tsaka know your enemy. Sabi ko, ang enemy natin di Chinese. Ang enemy natin yung virus.
That's correct. Well, we do not confront our brother Chinese, of course. Only the virus that we really trying to contain, no?
Well, alam mo, ang bilis ng oras natin, ha?
Tapos na mo.
And baka meron kang gustong
Parang-
sabihin pa sa ating mga nanonood o
Well,
from the Philippine Medical Association.
Well, I think people has to understand the mode of transmission,
Yes.
because probably in Wuhan, China, it started with the eating some probably, I don't know, exotic animals, raw, not cook well. So what do you call this zoonotic from the animals? It has also virus.
Totoo.
Coronavirus. When it get into contact with human, so it goes to the host of the human. So nagkakaroon po ng coronavirus also. We also have coronavirus. Mga sipon natin, that's coronavirus.
Oh.
So when this coronavirus of the animals going to get into contact with the human, nagkakaroon po ng mutation or combination.
Okay.
Nagkakaroon
So,
po,
ganun.
it can mutate. That's why probably the jury came from the infected animals. So ngayon, the host now, the human, can transmit it to human transmission.
Meron pa nga naging teorya nila na parang from the bat, ay ang
Yes.
nagdala daw sa humans, yung mga pangolin ba yun? Yung,
Pangolin
oo.
or bats.
Oo.
I don't know.
Well,
That's
for what,
still,
talaga?
they're still under investigation. But I think from then human to human, that's a problem now because of the probably the culture. I don't know, with the culture of the Chinese. Sometimes they spit out or they just I don't know. I just observed it when we had the opportunity to to visit China, no? Especially in the rural, no?
Mhm.
But basically, again, I would like to emphasize the proper hand washing,
Yes.
the cup etiquette,
Mhm.
and of course the proper nutrition,
Yes.
healthy lifestyle. No?
Okay.
You don't abuse yourself
Oo.
so much.
At nandyan ang ating mga medical practitioners, mga doktor, mga espesyalista para tulungan ang ating mga kababayan. Well, Dr. Santiago, maraming salamat
Thank
sa
you, Bishop, for
We
this.
will have more of you.
Yeah, of course, anytime. You just have to
Oo.
connect. Now that we are now partners
Yes.
in giving this kind of service, we can always assure that we can be always available for your all health needs.
That is.
But I think the things that's more. I think the UHC now. I think really focus now more on the prevention
That's
rather than the cure.
Sabi nga nila, an ounce of prevention is better than a pound of cure.
That's still very true up to now.
Okay. So more on this topic, ano-ano naman ang ginagawa mga hakbang sa mga urban poor areas upang maiwasan ang pagkalat ng infectious disease? Ano? Na pag-uusapan natin yan sa ating Espresso Self.
Mga usaping in, mga paksang trending,
Mga talakayang may kabuluhan.
lifestyle at kulturang sariling atin.
Buhay Pinoy, pag-usapan natin dito sa
Espresso Self! Ngayon ay taglamig na pero hindi lang kumot at mainit na kape ang kailangan natin. Ngayon na malamig ang panahon, mas kailangan natin mag-ingat sa mga sakit na nakakahawa. Alam mo, Erica, ngayong mga ganitong panahon ay talagang doble ingat ang aming pamilya. Doble sa alcohol, doble sa face mask, at saka doble sa pagmamahal na rin at multivitamins. Dahil nga sa mga kinakaharap natin, lalo na itong 2019 nCoV. Kayo ba? Kumusta yung pag-iingat ninyo?
Ayan, syempre pareho rin, Gabi, dahil lahat naman tayo gusto natin na hindi lang tayo, kundi syempre yung family natin ay protected. Pero totoo lahat ng mga sinabi mo. Lagi nga nating sinasabi, lalo na dito sa ating Lighthouse Cafe, na an ounce of prevention is better than a pound of cure. Kaya mas pinag-iigting natin ngayon ang good hygiene, basic washing of hands, at ang pag-inom ng mga vitamins para sa extra protection. At alam mo, Gabi, para nga sa atin na naninirahan dito sa Metro Manila, iniisip natin na madali lang access na sa gamot or sa ospital. Pero hindi lahat ay sa atin ay merong ganitong kakayanan, gaya na lamang ng mga kapwa natin na nasa urban poor area.
That's right, Erica, at nakakalungkot nga dahil ang pag-spread ng mga diseases ay mas mabilis sa mga urban poor areas. Ayon nga sa World Health Organization, slum areas' difficulty in access to safe water, access to good sanitation, at even durable housing structure contribute to higher health risk for those who live in this kind of condition. Tamang-tama naman at meron tayong expert, super expert talaga na makakasama natin today para tulungan tayong maintindihan ang disease management and control. At mas importante kung paano natin matutulungan ang ating mga kapwa.
Totoo yan, Gabi. Isa nga talaga siyang veterana, lalo na sa community development. Kaya huwag nating patagalin. At inang i-welcome sa Lighthouse Cafe. Hindi na siya bago sa atin, ang ating nutritionist dietitian, Miss Antoinette Hernandez.
Hi.
Wow!
Hi, wow!
Na-surprise ako. Surprise ako. Hindi ko naman birthday.
It's so nice to be here.
Wow. Yan, para alam ko, ito ang episode mo, ang segment mo, Espresso Self.
Pero okay lang.
Ayan. So, yan. Welcome again
Yes.
sa ating Espresso Self. So, siguro a short background muna. So, yan nga, community development. Paano ka ba napunta sa field na ito?
Community development kasi, syempre, nung after ko graduate, I graduated or I finished BS Community Nutrition actually nung undergrad. And then, syempre, with the term itself, community nutrition, so we have more units in terms of public health nutrition. Kasi yung course ko, nutrition, ay pwede kang mag-take up ng clinical nutrition, food management, or public health. So, yun. So, parang dun pa lang sa curriculum namin, talagang, kumbaga, nililid na talaga kami sa public health nutrition. But then, during that time, after kong mag-take ng board exam, parang naisip ko na, kailangan ko yata muna magpayaman bago ako makatulong. Kasi, di ba, usually parang kailangan gamitin mo yung sarili mong resources para makatulong ka. And then, sa biyaya ng Panginoon, our pastor, si Bishop Ruben, actually assigned me na maging program coordinator nung feeding training program during that time. So doon nabuksan, actually doon binukas ng Panginoon yung isip ko na, uy, I can actually do this as a profession, as a job. And then eventually, nag-search na ako ng mga job vacancies. May nag-pop up na yung opening sa work ko ngayon, which is Samaritan Spurs. So, kumaga unti-unti, pin-repair ng Panginoon, una yung puso ko, and then eventually yung desire ko na tas nag-open na siya ng way para mapunta na ako sa line na ito ngayon. So, humanitarian or community development, focusing on public health and public health nutrition.
Nakakatawa, Gabi, no? Kasi madalas tayo, pag after nating graduate, madalas inisip natin, paano ba tayo mag-improve sa isang work? Paano ba tayo magiging manager? Mga ganun. Pero nakakatawa si Antoinette. So, inisip niya rin yung community naman. So, yung one way of helping the community. And yun nga, even sa profession natin, we can make a difference kung saan tayo nilalagay.
That's right. Actually, hindi din naman ako original dun sa community nutrition. Before ako nandun, food technology muna ako. Pero, yun nga, when I was actually deciding to shift to community nutrition, ang pinakalaging tumatatak sa akin ay, ano bang gusto kong maging 5 years from now? And always na bumabalik na, I want to help. And I think, syempre, biyaya ng Panginoon niya, hindi lang ako dahil ako per se ay matulungin. Kundi, siguro, dahil din na-develop yung desire kong yun through the ministries that I've been involved with ever since I was young.
Actually, I'm so blessed just hearing the testimony of Antoinette. Actually, alam ko rin naman yung testimony niya. And I can see na even till now, yung passion niya, yung heart niya to help the people, yung being intentional niya, nandiyan pa rin talaga. But going back to yung urban poor areas, yung pinag-uusapan natin, tsaka mga common diseases, ano nga ba yung mga pinaka-common, mga top diseases pag ganitong mga areas?
Oh, actually, nabanggit niyo na nga kanina na access to water, to safe drinking water, and even yung mga, hindi lang sa safe drinking water, kundi yung facilities, sanitation facilities. Yun yung mga realities na nakita ko na since I started working in Manila, in Tondo, Manila. Aside from that, studies show, or sa data, sinasabi na ng DOH and WHO na pneumonia, tuberculosis, mainly respiratory diseases, and also mga HIV, actually slowly emerging na tong mga to. And of course, skin diseases due to environmental problems. So kanina nabanggit niyo rin yung housing problems, dahil alam niyo naman, close, kumbaga yung contact ng mga bahay, yun, some are living in stilts, yun, some are living sa, yun nga, tenement na supposedly nag-house lang ng 50 families. In reality, nag-house ng 200 families times 4. So that's around, how many is that? So, kaya talagang mabilis yung pag-transmit ng disease na ganun.
Bakit nga ba ganun? Paano siya nagiging mataas? Lalo na yung mabilis na hawaan ng mga ganitong klaseng diseases. Ano yung cause nun?
Ayun, una, yun nga, kasi syempre yung pag-transmit, iba-iba kasi yung pag-transmit ng diseases pwedeng through contact or pwedeng through yung droplet, katulad ng nCoV, di ba, yung droplet na respiratory droplets, or pwede rin naman, dahil hindi na tutugunan agad-agad yung health-seeking behavior ng tao, ng individual. Ito yung mga social determinants So, pwedeng, for example, may nararamdaman na masama yung tao, pero hindi niya muna yun, iindayin niya muna yun kasi kailangan niyang magtrabaho. So, uunahin niyang magtrabaho, tapos kapag malala na, doon na lang siya magsisik ng medical attention. So, syempre, yung severity ng disease, yung burden din ng disease, mas malala na. So, kaya mabilis
na makatipid, no? Parang mapapamahal ka pa talaga.
So, hindi rin, of course, hindi din matik na sabihin natin na, pag mahirap ka, tamad ka. Hindi mo siya masasabi ng automatic kasi hindi din natin alam kung ano yung everyday na kailangan nilang pagdaanan.
Nila, essentially. Obviously, it's not just isolated sa Tondo. May mga ibang areas din. Pero ano ba yung mga parang highly effective, not maybe highly effective, pero yung pinaka-common din na talagang ini-enforce or mga programs in general para sa mga ganitong mga types of areas?
Yeah. Actually, yun. Kapag pinag-usapan natin yan, we have to talk about yung lahat ng sectors. We call it multisectoral development kasi hindi naman pwede, let's say, sige, health ang problem. Pero kasi nakita nga natin na hindi naman health per se yun lang yung sector na kailangan mong tugunan. Kasi kapag ka nga nagkasakit or kapag ka nga nagtatrabaho yung tao, tapos nagkasakit siya, ano yung pwede mong, kumbaga, ipamalit habang siya ay nagpapagaling. So that's livelihoods, di ba? Livelihood sector. And then, kapag naman siya ay nagtatrabaho, paano niya masusustain yung kanyang pangkabuhayan kung wala siyang maayos na pagkain? So that's nutrition. So, kumbaga, kabit-kabit talaga. Oo. So we cannot really say that one program can solve everything. Kailangan talaga collaboration, tapos kailangan yung mga program implementers like us ay bumababa talaga sa community to know what really is yung reality sa ground. Hindi pwede na, ito yung feeling ko na makakatulong. Sige, baba natin to sa ground. Paano kung hindi pala yun talaga yung problema? So, di mo na-address yung talagang dapat na, yung mga underlying causes kung bakit may ganong mga problems sa community. So, basically, wala siyang isang direktang...
one formula, one size fits all.
No, definitely. Yeah. So, even in nutrition, kasi ako yung nutritionist, nutrition, naniniwala kami na it's not a standalone program. Kasi, pagka may sakit yung bata, hindi mo naman pwedeng pakainin lang ng pakainin. Kailangan i-solve mo yung bakit siya nagkasakit. Pwedeng dahil hindi safe yung drinking water niya. So, that's already wash or water sanitation and hygiene. Yun. So, kailangan bigyan mo rin sila ng sanitation facilities para dun sila makadumi, dun sila makaihi. So, talaga siya multi-sectoral, malawak talaga siya.
Yan nga, yung talagang hindi mo lang i-address kung ano yung nakikita mo. Yung pala meron pa siyang parang roots from there. Pero siguro, would you say na ang siguro yung first step doon is really yung civic awareness and yung health education? Or mahalaga ba siya na malaman din, lalo na dito sa urban poor areas?
Yes, definitely knowledge, sabi nga, di ba? Knowledge is power. So, pero tama yun. Kasi first step to behavioral change is knowledge eh. So, paano nga naman mag-change yung behavior ng isang tao kung hindi niya alam kung ano yung kailangan niya? So, for us, for example, we try to educate mothers to how to take care of their children. Actually, hindi lang children, kundi sarili muna nila. So, sa pagbubuntis nila, kailangan nagpapa-prenatal check-up 4 times, yun yung standard. Tapos, kailangan yung mga kinakain nila and everything. So, yes, definitely civic awareness or knowledge or education, health education and other sectors na kailangan nila. So, for example, dito ngayon, sa pinagdadaanan natin na nCoV or COVID, may bago na siyang pangalan today. COVID19, oo. Grabe, sobrang dami na nagpapanik yung mga tao. But then, bakit ba sila nagpapanik? Baka hindi lang din sila aware na hindi naman kasi yan ganun kumbaga yung fatality rate niya ay ganun kataas.
Lalo na ngayon na ang daming fake news talaga na hindi mo na minsan pag tumingin kasi internet, parang ayaw mo na lang din tignan. Totoo. Kasi hindi mo na alam kung ano bang totoo, how true is ito or versus dito, di ba?
So yes, awareness ay yung first step for us to be able to siguro control and even prevent something.
Actually, yung panic, para mas malaking sakit siya lately.
Fake news is a
fake
plague.
News,
Yun
talagang doon kakakabahan eh. Si Erica touched on civic awareness. Meron ka ba nakikitang challenges in terms of, I don't know, availability ng mga in community natin, or is it reception sa mga pinashare ninyo, or is it yung discipline na pag sinabi nyo to, ginagawa ba nila? What's the bigger problem or challenge for you?
Definitely, pag hindi yun, kunyari yung tinuturo namin, for example, about nutrition na lang, pag hindi siya perceived need nung community or nung tao, hindi niya yan tatanggapin. Pag inisip niya na, hindi ko naman yan kailangan, o yun nga, for example, mas kailangan kong magtrabaho kaysa malaman yung paano, pakainin ko lang yan, okay na yan. So, definitely, yun pa lang, problema na parang yun pa lang, nagpo-form ka na ng barrier dun sa parang pagka-come across nung gusto mong ibahagi sa kanila. So, paano natin yun sinusolusyonan? It's through community mobilization. Kailangan kilalanin mo muna yung community. What's their language? Ano yung reality nila? O kailangan makita muna nila na, itong mga taong to, naiintindihan nila where I'm coming from. So, kaya actually, yung isang approach namin is through educating leader mothers so that these leader mothers ang nag-educate sa kapwa nila mothers.
So sila yung nakikipag-communicate talaga kasi sila yung may experience.
Sila yung,
the same,
hindi naman
right?
ako nanay, single ako. So, syempre, mas maniniwala yung tao pagka nakaka-relate ka doon. So, yun. Kaya, community development, maganda siya na vocation, pero it entails a lot of work talaga, yun.
Yeah, and you really need to invest time and, even yung pagkuha mo ng trust and building that relationship, it takes time. So I'm sure, and talking about hundreds of families, medyo mahirap nga naman yun. And hopefully maging effective yung ganitong program. What about yung partnership mo? Kasi you mentioned kanina multi-sectoral, yung support, partnership, collaboration among different organizations and kumusta naman siya sa experience mo?
Good thing ay dahil dito sa Philippines, marami rin namang mga organizations talaga, and especially in slum areas. So definitely, we try to not duplicate. Hopefully, we don't want to duplicate things na ginagawa na ng, kunyari, isang organization. Sige, ano naman yung pwede? Yung kumaga, we fill in the gaps. But aside from organizations, we also want to partner, and we try to partner as much as possible with the local government unit. So yun yung mga ibang stakeholders. And definitely, ang mga, kunyari ako, organizations, hindi naman kami forever na naandun. So kailangan yung sustainability. Umpisa pa lang ng lahat ng ginagawa namin, tinitrain na namin yung, especially kunyari barangay, na pag yung dumating yung time na umalis kami, kaya nilang tumayo on their own. Na hindi sila nakadepende sa amin. Sadly, yun yung usual na nangyayari, yung dependency. For example, a feeding program na it's been going on for how many years, nagiging dependent yung mga tao doon kasi hindi sila umaalis. Hindi nila na bibigyan ng, hindi na na-empower yung mga beneficiaries. So, yun. Pero yes, definitely collaboration and partnership is important kasi we cannot really solve everything on our own at we're not there for forever. So, talagang iiwan mo yan. So, kailangan mong i-empower yung mga nandun sa community.
Napakaganda yan. Sustainability talaga.
Yes.
Yan talaga yung maganda. Kasi yun nga, pag yung parang hinayaan lang natin na tayo yung mag-spoon feed talaga. In the end, parang mawawala din siya and parang nasayang din lahat ng hard work. So yan, napakaganda. Nakita natin na napakalawak pala talaga ng community development. Pero yun, medyo kinapos na tayo sa oras. Pero thank you for your time,
Yes,
Antoinette.
thank you. Sorry, if I may also add, hindi lang pala stakeholders or government, especially the churches. We partner with the churches kasi sila yung nandito. Like, for example, in our church, Lighthouse, tayo yung nandito. So, kailangan, ini-empower din natin yung church to reach out kasi yun naman yun din yung purpose ng Panginoon para sa kanyang eklesiya.
And lagi yan sinasabi ni Pastor tayo sa Lighthouse, di naman na tayo aalis dito. So,
Exactly.
all the more na dapat talaga tayo yung magkaroon ng difference sa community natin.
Well, thank you very much, Antoinette. Talagang kita-kita mo yung passion niya. It's a good, experience na makilala natin si Antoinette, the Community Development Officer,
Yes.
versus,
Yung different side
oh,
niya, aside
different
from
side.
hosting.
From hosting, your singing, and all that. But
Yeah.
praise God, Antoinette, for you, the organization, the church, especially for you for stewarding, your gift, your calling, your ministry dito sa area na to. As Galatians 6:2 that tells us, to carry each other's burdens and so that we may fulfill the law of Christ. For more biblical insights, let's listen to Bishop Ruben in Hebrews.
Welcome to Hebrews. Ito po ang bahagi ng ating Lighthouse Cafe na naglalayo na bigyan daan po ang kung ano makikita natin sa banal na kasulatan patungkol sa mga nangyayari po sa ating kabuhayan at patungkol din naman sa pinag-uusapan natin sa episode na ito ng Lighthouse Cafe Talk Show. Sa kalagitnaan po ng tinatawag nating COVID-19 or otherwise, ang ilan po ay they refer to this as nCoV na po, 2019 o alam natin na coronavirus ay mayroon ding guidelines po tayo na magandang kunin mula sa banal na kasulatan. Alam po natin na wala pong nangyayari sa buhay ng tao na iniisip natin na ngayon lang nangyari o bagong-bago ito. You see, the Bible says in 1 Peter chapter 4 and verse 12, ang sabi po rito ay, Beloved, think it not strange concerning the fiery trial which is to try you, as though some strange thing happened unto you. Now, new things may come in our lives. Subalit, palagi po na ang katotohanan ng salita ng Diyos ay napaka-praktikal kung gagawin po natin at gagamitin sa ating buhay. So, I'd like to propose the following guidelines. Ano po? Sa kalagitnaan ng tinatawag ng COVID-19. Number 1 po, ang pinakamahalaga, do not be overcome by fear. Do not panic. Magkaroon po tayo ng kaalaman, knowledge. Hosea chapter 4 verse 6 says, My people are destroyed for lack of knowledge. Kaalaman po palagi ang napakagandang sandigan sa lahat ng hinaharap natin sa ating buhay. Lalo na po ang katotohanan tungkol sa salita ng Diyos. Katotohanan tungkol sa dapat nating sandigan sa ating buhay. So, kasabay po nito, kaantabay po nito, ay kinakailangan po, yun lang makatotohanan na impormasyon ang dapat po nating tingnan, pakinggan, at i-share. Lalo na yun ang gagaling sa social media. Okay? So, tandaan po natin, number 1 ay be knowledgeable. Do not be overcome by fear. Number 2, keep ourselves healthy. Ano po? Itaas po natin ang ating immune system. Take vitamins. Kumain tayo ng maayos. Lalo yung mga vitamin C, vitamin D, vitamin A, ang zinc. Mahalaga po sa atin yan. Take extra precaution. Ito, tayong mga may diabetes o kaya naman merong mga high blood na mga bouts sa ating buhay. 3 John chapter 1 verse 2 says, Beloved, I wish above all that thou mayest be prosperous and be in health. Number 3, be clean. Observe good hygiene. Wash hands. Yung ating po mga face masks, ano po? Kapag single use lang po yan, huwag natin uulitin, ano po? At tingnan natin, lalo na po yung paggamit natin ng mga palikuran, yung mga public toilets, mag-iingat po tayo, ano po? Well, wala pa naman tayong kalat na kalat dito na COVID-19 sa atin. Subalit, usong-uso naman po talaga ang flu, ano po? So mag-iingat po tayo. At doon po sa Psalm 24 and verses 4 to 5, sinasabi po doon, He that hath clean hands and a pure heart. Well, of course, merong ibang pakahulugan yan para sa ating mga mananampalataya. But in the most practical sense, maigi po na palaging malinis ano po, ang ating katawan, lalo na ang ating kamay. Number 4, kung meron po tayong colds or cough, at meron tayong lagnat, tayo naman po ang magbigay na ng limitasyon sa ating mga sarili. Do not expose yourselves to unnecessary situations. Ang sinasabi ng Ephesians chapter 5 and verse 15, ang sabi, See then that ye walk circumspectly, not as fools, but as wise, understanding what the will of the Lord is. Tayo na rin po ang mag-obserba ng mga limitasyon po natin, ng mga pag-iingat na mayroon tayo. Number 5, know that they are not the Chinese who are the enemy. Hindi po. Alam niyo po, itong sa kalagitnaan ng COVID-19 na ito, mayroong mga tao na ang nangyayari po, imbis na tingnan kung ano talaga ang virus, ina-attach po itong mga kababayan natin o mga kaibigan natin, mga Chinese. Hindi po sila ang ating kaaway. Ang virus po ang ating kaaway. Kaya ilagay natin sa tama ang ating pag-uugali, ang ating reaction. Ano po? Minsan lalong nagkakaroon ng discrimination sa ating kapaligiran. Okay? We wrestle not against flesh and blood, but against principalities, against powers, against the rulers of the darkness of this world. Yan po ang sinasabi sa Ephesians 6 and verse 12. Number 6, let us be vigilant in all things. Ang sabi ni Peter sa atin, be sober. Be vigilant, because your adversary the devil, as a roaring lion, walketh about, seeking whom he may devour. Kahit man po mag-ingat tayo sa coronavirus, baka naman ibang virus naman na mapunta po sa atin. Kaya mas mahalaga na meron tayong awareness, no? pagiging vigilant in all things sa mga pinupuntahang lugar kung saan tayo na-expose. And of course, lastly, at napakahalaga po nito, value your relationship with God. Ano po? Basahin natin ang kanyang salita. Mag-devotion tayo, manalangin tayo. Maglingkod tayo sa Panginoon. At maging concerned po tayo sa mga tao. Minister to people. Kapag nawala po sa atin ang ganitong kalooban, lalo tayo magkakasakit. Ano po? Hindi natin mai-echipwera po sa ating buhay ang tungkol sa ating pananampalataya. Yan ang unang-unang dapat na ating tinitingnan. Let's be concerned with people. Ano man yan, okay? Hindi lang po yung bagay na material, kundi yung bagay sa buong pagkatao. At sana po naging mahalaga para sa ating lahat ang mga guidelines pong ito. 7 points para sa ating kapakanan, para sa ating kalinisan, para sa ating wellness. Pagpalain tayo ng ating Panginoon.
Ang Enero at Pebrero ay ang pinakamalalamig na buwan sa ating bansa at kasabay nga ng malamig na simoy ng hangin ay ang mga kaakibat nitong mga sipon, ubo at lagnat lalo na sa mga bata.
Tama yan, Harvey. Dagdag pangamba rin ito dahil alam naman nating tayo ay humaharap sa isang worldwide health concern dala ng 2019 coronavirus. Actually, marami akong nakikita mga nakamask at pati na rin sa mga school-age children ay required na rin silang mag-mask.
Kaya naman, napapanahon na pag-usapan ngayon ang tungkol sa iba't ibang nakakahawang sakit dala nga nitong mga viruses. At ano-ano nga ba ang mga common na viral infections, ang mga sintomas nito at paano ito may iwasan. At kasama natin ngayon ang isang eksperto, an infectious disease specialist from the Quezon City Medical Society. Let's welcome to our Health Talk segment, Dr. Shane Marte.
Thank you.
Welcome po.
Thank you,
Good day po.
Disney. Thank you, Harvey.
Welcome po sa Lighthouse Cafe. Ayan, so Doc, napag-usapan po natin itong sikat na sikat ngayon o napapanahon na coronavirus. Pwede po ba nating bigyan ng general information ng ating pong mga manonood kung ano nga po ba ang coronavirus?
Yung coronaviruses, isang pamilya ng mga viruses na actually nagdudulot lang siya actually ng common cold. And then, kung lumubha man ito, no, it will lead to pneumonia and sometimes death.
How about po yung viral diseases? Ano po ba yung viral diseases?
Mga viral diseases are caused by viruses. So ang viral infections na very common ngayon, especially kung taglamig, no, ay the common cold, viral bronchitis, viral pneumonia, tsaka flu.
Sino po ba yung madalas na tinatamaan ng ganong diseases?
When it comes to the age, so usually yung children, especially the school-age children, are affected with colds, no, with the common cold. So kung sa school-age children, it will be 6 to 12 times in a year. Pero kung adult, 2 to 3 times lang. No? Pag elderly naman, talagang because of the declining immunity, mas madali din silang magka-viral infections.
So parang yung tinatawag po na high-risk profile, yung
Yes.
children and
Yes.
elders.
Yeah. And to add to that, when it comes to male versus female, mas weaker daw ang immune system ng males. Especially when it comes to viral respiratory infections. Ang symptoms nila ay worse, it takes longer to subside, at mas madali silang mamatay dahil sa flu, yung mga lalaki. Yeah?
Ganun pala. So, mas
And
mahirap pala.
when it comes to lifestyle naman, yung mga smokers, usually they are prone to viral respiratory infections, and yung when it comes to yung living conditions mo, if you live in a situation na overcrowded kayo, madali lang talaga maghawa-hawa. Yes.
Marami pa naman po yun sa atin po.
Yes, of
Doc,
course.
ano po ba yung
Sa
mga
Pilipinas.
karaniwang simptomas nitong coronavirus nga po?
Yung COVID-19, no? That's the new name ngayon. So, ang symptoms niya ay ubo, sipon, lagnat, yung pag-iksi o paghirap sa paghinga.
So, Doc, medyo normal siya na simptomas po, ano? So, paano po kaya natin ma-differentiate? Let's say, nagkaroon po ako ng ubo, sipon, lagnat, ganyan. Paano ko malalaman kung coronavirus po ba ito or simpleng simptomas lang po?
So actually, bagong uri ang COVID-19 natin. Bagong uri siya ng coronavirus. But actually, coronaviruses were here for a long time. Meron tayong alpha coronaviruses, beta coronaviruses. Yung malubha lang yung SARS at saka MERS-CoV. Pero actually, ang coronavirus are common. They are cause of common cold nga. Pero itong bagong uri ngayon, no, kung malubha siya, it will lead to pneumonia, no? Tapos nagbo-worsen siya, it can cause death talaga. Kung hindi, pag mag-worsen.
Apo, iyan Dok. Speaking of yung pagiging malubha, paano po natin malalaman, let's say, ng isang katulad na pasyente, ganyan, meron po siyang mga simptomas na kailan ko po malalaman na malubha na at kailangan ko na pong magpa-check up sa doktor?
For this COVID,
Yes po.
actually, you need an epidemiological link. Kailangan either galing ka ng Wuhan, China, or you have an interaction with talagang a confirmed case, or kasama mo ba sa bahay, o talagang with contact ka with a confirmed case talaga. Yes. And then you have these symptoms, these respiratory symptoms, you have cough, you have or sipon, no? Other respiratory symptoms yun. So kailangan we always check, may contact ka ba sa taong merong COVID-19.
Okay po. Paano po malalaman kung kailangan na magpa-check?
Okay, sige. Actually, if you have contact with a person with COVID-19, kailangan talaga either you quarantine yourself, talagang voluntary isolation. And if you develop symptoms, kasi ang incubation period natin is 2 to 14 days, hindi pa sigurado because under study pa siya. So sa 14 days na yan, you quarantine yourself, and if you develop symptoms, that's when you go to a hospital na for a
Doc,
checkup.
para sa mga
Yes.
manonood po natin, when you say you quarantine yourself, or let's say yung voluntary po, ano po ba
Yes.
yung mga methods or paano po ba natin gagawin ito?
Okay. Ang self-quarantine is usually you stay home, and then you watch, if you have symptoms, mag-check ka ng temperature mo, no? Every 4 hours, you check for signs na, oops, parang sinisipon ako, sore throat, any problem sa paghinga.
So kailangan
Okay.
po lahat ng simptomas ay nandun para po masabi natin?
No, pwedeng fever lang, o pwedeng ubo lang.
So not necessarily po
pwedeng
na...
sipon lang. Yeah, and then kung meron kang ang contact with confirmed COVID-19, kailangan talaga magpa-check up ka. Yeah, and there are hospitals, no? Kasi alam naman ng especially DOH affiliated hospitals, alam na nila kung ano ang protocols when it comes to COVID-19 cases.
Buti na lang po. Pero kung self-quarantine po, kunwari ako po, magiging effective po ba kung magagamot ako, mag-antibiotics ako?
Okay. So remember, COVID-19 is a virus. Antibiotics doesn't help. Oo, so as much as possible, you drink a lot of fluids. And then, supportive care kasi tayo, meaning sa supportive care, basihan ang simptomas sa gagamutin sa'yo. So if you have cough, we can give cough medicine. Kung may sipon, para sa sipon. If you have fever, antipyretics para matanggal yung lagnat. If you have pain, body malaise, no? We give pain relievers. Ganun siya.
Doc, let's go po dun sa kung paano siya na ita-transfer. Is it airborne or paano po ba siya by contact?
Okay. So, ang transmission talaga from isang tao to another tao is ang alam sa ngayon, it is through respiratory droplet. No? Respiratory droplet sa pag-ubo, pagbahing, no? At saka contact. So fomites also has a role, like ikaw yung dura or when you sneeze, tapos naghawa ka sa mga public installations natin like a doorknob or rails. So within during that 4 hours, pwede pang mag-survive ang virus kasi. From that public installation, like the doorknob, common CR, di ba? Common CR na doorknob. So, during that time, pwedeng makahawa ka ng another na tao if he touches his nose, his eyes, his mouth, ganon. Yeah,
Totoo po ba na mas nagsistay po yung virus sa metals? May ganun po na
No,
tinatawag?
actually it's fomites, non-living thing siya, nothing in particular. Actually sa panyo mo, if you use a panyo, so actually kasi we prefer na you use napkin or tissue, and then you just dispose of it in a covered bin kaysa panyo, kasi after magbahing ka, you use it again and reuse it again. So as much as possible, you dispose of it right away. Oo.
Actually, ibig sabihin po, pag nagmamask po, mas recommended yung disposable kaysa sa cloth.
Yeah, as much as possible. But okay, because of logistic purposes, di ba? Nagkakahirapan na tayo sa surgical mask, better you buy na lang the washable mask kung kaysa wala naman na talagang ibang alternative. Yes.
So yung sa precautionary measures naman po tayo, Doc, paano po ba may iwasan yung transfer? Let's say yun nga po, nangyari na hindi mo alam, of course, you're in a public place, 8 hours a day, lalo na pag nagtatrabaho ka. Ano po yung mga po pwedeng gawin ng normal na nasa labas na nagtatrabaho?
Okay. So, if you're healthy,
Yes po.
if you're healthy, if you're thinking that you're healthy, so as much as possible, you have to protect yourself. No? So kung may nakikita ka kasama mo sa trabaho o sa school o sa bahay, no, lumayo-layo ka na. Kung inuubot sinisipon naman siya kasi baka matapunan ka ng respiratory droplet niya. And of course, hand hygiene is very important talaga. No? Hand hygiene, if you have an alcohol rub, no, alcohol sanitizer, or talagang 70% alcohol, or if you have soap and water at home, you wash your hands frequently talaga. So yun, and you keep yourself clean, bath daily, keep your environment
po, no, kailangan
clean.
maligo
Yeah,
araw-araw.
pwede namang mag-init ng tubig, di ba?
Tama po.
So you have to clean your surroundings as well. Kung ikaw ay unhealthy, you have respiratory symptoms, buti mag-mask ka talaga so that hindi ka makahawa ng iba. And of course, you use tissue, napkin, to cover your mouth, or handkerchief to cover your mouth and ilong. No, kung ubo ka man, bumahin, no, or sneeze. So as much as possible, no, kung wala kang panyo or tissue, you use your sleeve, yung braso mo. As much as possible kasi if you are in a crowded area, no, if you cough, kailangan talaga turn away. Turn away from that person or move away kung nababahing o nauubo ka na. Kasi talagang direct hit siya yung person in front of you. So kasama yan sa sinasabi nating cough etiquette. No? You dispose of your dura. Kung dura ka man, lagay mo sa tissue, you have to throw it in a covered trash bin, no? Immediately. Immediately. Yeah. And then actually the sunlight, UV light, UV rays from the sun, they can kill the virus. So, yun, keep your room ventilated, wag i-close yung windows, let the air in para maganda yung air exchanges sa kwarto mo. So, yun. And then you keep your area clean. Gumamit tayo ng bleach solution, 1:10, no? 1 part of bleach, 10 parts water. So yun, mag-map ka, mag-clean ka sa surroundings mo. So
proper hygiene din po talaga,
yes.
Doc.
Yes.
And paano po kaya natin yun, aside from yung mga pag-inom ng vitamin C and of course yung lots of liquid, may isa-suggest niyo po ba, Doc, ang pag-intake ng mga herbal supplements? Is that effective po?
Actually, I'm not so into that, herbal supplements, because complementary siya. But we have the talagang mga gamot eh. We have the well-researched na mga medicines that have been studied, no? Researched well. Ang problema, kung if I prescribe to you an herbal supplement with no therapeutic claim, what is that? So I'll just be wasting your money, right? But the proven ones are, of course, kung may antiviral, if there is, no, antiviral for the flu, it's available, oseltamivir. If you have like, zinc is very good. It decreases the symptoms and also the time from recovery. So mas maganda ang zinc. Of course, multivitamins, you just eat, no, you just eat healthy food. Yun, and drink lots of fluids, of course. Rest. Adequate rest, and of course, adequate sleep.
Okay po. So, hindi lang po talaga siya vitamin C. Ang dami pa palang
Yes.
pwede.
Multivitamins ang maganda. Yeah.
Okay po. Meron pa po ba kayong last na mga tips po for our audience?
Your health is in your hands. So you have to wash your hands, keep it clean, no? Even before eating, after eating, no? You have to bath daily, no? You have to clean your surroundings and consult your doctor, no? If you have any symptoms, any respiratory symptoms, pwede naman yun.
Okay po. Ayan, thank you po. Thank you, Doc Shane.
Thank you
so
po,
much.
Doc Shane.
So, napaka
Informative din,
informative.
yes.
Alis na tayo sa fake news po tungkol sa
Totoo po.
COVID.
Thank you so much.
Tama ba?
COVID-19.
COVID-19. Okay po. Ayan, thank you po ulit, Doc Shane. And sana po, tulad namin ni Harvey, ay kayo po ay natuto rin po tungkol dito sa coronavirus.
At tandaan po natin na ang ating kalusugan ay biyaya ng Panginoon, kaya't pag-ingatan natin ito. At para sa mga karagdagan pang impormasyon sa ating kalusugan, abangan po ninyo kami muli sa susunod na linggo dito lang sa Health Talk!
At natapos na naman ang isang oras na magagandang kwentuhan. We hope you enjoyed all our discussions today.
And you can watch a replay of our episode today sa aming Lighthouse Spectrum mobile app. I-download nyo na po from the App Store and the Google Play Store. At maaari nyo rin po kaming mapanood sa aming Lighthouse BBC YouTube channel. And be sure to like, subscribe, and share.
And we would also like to thank our ministry partners and sponsors who have faithfully supported our various shows and productions. Maraming salamat po sa 4 Gospel Catering Services, Haircutters Republic, Miami Cakes, and Lighthouse Blooms Flower Shop.
Maraming salamat din po sa ating mga individual sponsors who continue to partner with us. You can also be our ministry partner. Just send us a message to our official Facebook page, Lighthouse Cafe.
That's right, Daisy. At bukod po sa GCTV ay tuloy-tuloy pa rin po ang Lighthouse Cafe sa Pop Life TV. Watch us every morning sa Pop Life TV sa Channel 72 at Sky Cable at pwede nyo rin pong scanan yung mga digital boxes for Pop Life TV.
And so catch another episode next week, only here at the Lighthouse Cafe,
Where good talks happen.